Roper on communication. Communication is a broad topic, and this part of the course looks deeper into the issues around communication from Roper, Logan, and Tierney's model of nursing. The ADL of communication is concerned with conveying meanings from one person to another using mutually understood language, spoken word, signs, body language or symbols, writing. For communication to happen, the patient must be able to recognize the message and understand the meaning. If the patient's ability to understand what is said is restricted, or they are unable to express their own thoughts or feelings, then there is a problem with the ADL of communication and a dependency exists. The nurse should plan care to help the patient to communicate if possible. Roper et al. 2000. Physical factors affecting communication. As with all of Roper's ADLs, we must look at the patient holistically. Physical factors that affect Patrick's ability to perform this ADL. These physical factors are what you observe when assessing Patrick's physical injury or a physical disability. If that injury or disability affects Patrick's ability to perform the ADL of communication, you should plan how to assist him to better communicate with nursing staff, family, and friends. Patrick's physical ability to communicate. Patrick has the following physical factors that are affecting his ability to communicate effectively. He is dependent on eyeglasses to see people's faces, and he is finding it difficult to breathe and is wearing a face mask. As with all of Roper's ADLs, we must assess not only the physical aspects affecting a patient's ability to communicate, but also the psychological and sociological factors. Psychological factors affecting the ADL of communication. The ADL of communication has significant effect on the patient's quality of life. Social interactions are central to the patient's role in the family and wider society. Any limitation of communication can lead to extreme frustration and depression. Roper states that it is a human need for the patient to be able to express their wants and needs and have meaningful communication with those that are close to them. The nursing assessment is not restricted only to what the patient says. It is also about picking up on cues from body language and empathizing with the patient. Patrick is feeling low in mood due to difficulty in breathing, and also he is worried about his dog at home alone. Reassurance is required at this time, and the family and any other informal carers should be made aware of this. Sociological factors in the ADL of communication. Roper, Logan, and Tierney's model asks for nurses to consider each patient as a person who is a member of a family and community. Patrick is a father and a widow. He is quite isolated a lot of the time and doesn't tend to speak to his daughter, who lives next door. Although communication is not a priority health need, it is a vital part of work as nurses and can be factored into Patrick's care plan as a nursing intervention. That is, keeping him informed, offering reassurance and explanations for treatment and procedures.